So now we are going to group B question, that is pressure volume loop. Pressure volume loop of left ventricle. Pressure volume loop of left ventricle. It's more popular for group B, but sometimes as a sub question it may come at group A too. So what is pressure volume loop? It's a graphical representation of changes of volume according to pressure or pressure according to volume that happens in left ventricle in cardiac cycle, in various phases of cardiac cycle. So diagram is mandatory in this question. It's a graph in which x-axis denotes volume, that means it will be in milliliter, and y-axis will denote pressure, so that will be in millimeter of mercury. So first I shall draw the graph and then I shall explain. So this graph is just like this, simple to draw. It will come like this and then it will come like this. So we can get this, yeah. It's starting from here and then it is going over here, then it is coming over here, and then it is this. So this is 60 ml mark on the volume axis. This is 130 ml mark on the volume axis, that is on the pressure axis. So if we look at what is actually happening in this pressure volume graph. In the beginning, you see this is left ventricular volume, and this is the point when left ventricular volume is at its lowest. So when it is possible, left ventricular volume is the lowest at the end of systole, because in systole left ventricle has ejected out, has vomited out everything, not everything, most of its thing. That means ejection fraction part of blood is already out. Remember, left ventricle is never empty. EDV is the end of diastole volume and ESV is end of systolic volume. Remember, due to systole, left ventricle is never empty, but a majority chunk of blood is out, and that is normally the ejection fraction. 65% and above blood is out. During exercise it may even be higher, up to 80%, 85% blood is out of left ventricle during this. So this is end systolic volume, volume of blood that is left in ventricle after systole is over, and this is only 60 ml. And after that, you see there is on the pressure axis, the pressure is almost at a plateau or slowly building up. There is no jumping of pressure, and it is going towards the diastole. This is the end diastolic volume. Here it is the end of diastole. So after diastole is over, two important things happen. One is systole begins, but before that, at valvular level, one thing happens, that diastole is over means AV valve closes. So which one is AV valve here? Mitral valve. Mitral valve closes. After that, you can see there is steady rise in pressure, but no change in volume. So this is the phase of isovolumetric contraction, when LVP is shooting up, but left ventricle is a closed chamber. Mitral and aortic both valves are closed, therefore there is no change in volume. So on volume axis there is no displacement, on x-axis there is no displacement. It is still at 130 ml volume, but the pressure is mounting up, and it is mounting up to 120 or even more. And then a period comes when left ventricular pressure is greater than aortic pressure, and that's why semilunar valves, aortic valve opens. As aortic valve opens, initially you can see there is loss of volume and increase of pressure, and that is the first phase. This phase is rapid ejection. So there is rapid ejection of blood from left ventricle into aorta, and after some time the gradient falls down, pressure gradient falls down, therefore pressure is falling down, volume is also getting shortened, and this zone is the slow ejection phase. Slow ejection phase. At the end of slow ejection phase, one thing happens when left ventricular pressure is lesser than aortic pressure and there is no more inertia left. So, at that time, aortic valve closes. Closure of aortic valve means one particular event, that is S2, and it also means another particular event, that is end of systole. At the end of systole, one thing is happening, that is ventricle is again a closed chamber. Aortic valve is closed, mitral valve is yet to open, and at the end of systole, since it is at the end of systole, diastole or the relaxation has started. So ventricular pressure is coming down because diastole has started, and ventricular volume is at the same zone because this is isovolumetric relaxation. At the end of isovolumetric relaxation, what happens? When the rapid filling phase starts, and rapid filling phase, before rapid filling phase starts, one thing happens, that is mitral valve opens. So in short, this is pressure volume loop. We have explained it, and with the help of this explanation, you can also understand various stages in cardiac cycle with various changes in pressure and volume, and also opening and closure of different valves throughout the cardiac cycle. You can expect this question as a 7-mark question, or at times in group C as a 4-mark question, or sometimes with a long question of based on cardiac cycle. It may also appear in the university exam.